Hello, everyone. Welcome to the Black Health Matters Summit, and we thank our wonderful partners, Boston Scientifics, Close the Gap, and Siemens Health in Years. That's so catchy. So I love that theme, that title. We have had a robust day. We've learned so much about COVID, the types of vaccines that are out there, and the talk with Dr. Adam Arthur was just outrageous in terms of learning about the impact of stroke on people who have had COVID. So he just shared so much great information. We are sharing it to Facebook as well if you want to be able to get a snippet. In terms of housekeeping, we appreciate you all hanging out and being at the chats. Please go to the exhibit hall. Again, we have more than 15 organizations present. They have information for you that you can download. Make sure you stop in and say hello. Come to the Black Health Matters booth, introduce yourselves. We have a couple people from our team there. I will be there. So I'm looking forward to meeting you. So please take advantage of that. Lastly, did I mention about the leaderboard? We have great prizes. So the more that you interact and watch sessions and ask questions, that tease you up for prizes. Everybody likes a hookup. So we've got good things for you. And now I take pleasure in introducing our next presenter, C. Virginia Fields. C. Virginia Fields is the president and CEO of the National Black Leadership Commission on Health, otherwise known as NBLCH. She brings to the position over 18 years of experience as an elected official in New York City, where she won widespread praise as a consensus builder around important city, state, and national policy issues. But I had an opportunity to read about her on one of those Wikipedia pages. I mean, she's marched, she's been arrested. So you can't have a better advocate than someone who has, put their life on the line for humanity. So we're so pleased to have her. She is the former president of the Borough of Manhattan of New York City. As a chief executive, she was elected, again, Manhattan Borough president, and reelected in 2001. In 2005, she was a Democratic candidate for mayor of New York City, becoming the first woman, African American woman, to seek that office. Under her leadership as president and CEO of NBLCH, this organization has grown to include 12 affiliates and over 150 national partners in furthering its mission to educate and empower Black leaders to meet the challenge of fighting AIDS and other chronic illnesses that impact the African American community most. As a leading advocacy organization and change agent, born of 31 years of service to the African American community, NBLCH has broadened its scope to include many health disparities beyond HIV/AIDS. Born in Birmingham, Alabama, Ms. Fields received a Bachelor of Arts degree from Knoxville College in Tennessee, where she currently serves as a member of the Board of Trustees. She has a master's degree in social work from Indiana University. She is a member of Alpha Kappa Alpha sorority, and the historic Abyssinian Baptist Church, of which I too am a member. And she is a member of the Greater New York chapter of the Lynx, a recipient of numerous awards, citations, and honors of distinction for her leadership on health, education, community, civil rights, and social justice issues. Ms. Fields resides in New York City. And now I have the pleasure of introducing you to C. Virginia Fields.
Thank you. Thank you so much, Rosalind, for that very, very warm introduction. And I am just delighted to be here with you and everyone else who is a part of this event. I wish you well and all of your team on your second virtual town hall convention. This is truly exciting. So for the time allotted, I'm going to speak about the organization in terms of what it is that our organization has been involved with, and something about the work we're doing with with Black health in terms of this epidemic. Rosalind mentioned that the National Black Leadership Commission on Health actually formally was the National Black Leadership Commission on AIDS. And this is a national organization for over 37 years that had been educating, mobilizing, and working with local leaders to meet the challenges of fighting HIV/AIDS. And of course, having evolved over a 37-year period. Back in November of 2019, we, after a 2-year rebranding process, we were renamed, have a new mission, new focus, and now we are the National Black Leadership Commission on Health, with a new mission that speaks to champion the promotion of health and prevention of diseases to reduce disparities and achieve equity within the Black community. Our vision, we want to help to reduce disparities. We know that we need to achieve health equity by promoting, or can achieve health equity by promoting the health and well-being of Black communities through advocacy, policy, and action. So Rosalind also mentioned, with this rebranding, we have now expanded our health focus areas. We know that HIV does not stand alone, but there is an intersectionality of HIV with all of the other 7 health diseases that disproportionately impact Black African Americans. HIV/AIDS, African Americans, 1 in 7 are living with HIV and don't even know it. When we look at mental health, African Americans are 20% more likely to have serious mental health problems than the general population. When we look at prostate cancer, 1 in 5 men will be diagnosed in their lifetime. And with breast cancer, Black women are 40% more likely to die from breast cancer than their white counterparts. And cardiovascular disease, Blacks are leading in terms of mortality in this area. And we have 33% higher death rates from cardiovascular disease than the rest of the population. And these are the health focus areas that we have now expanded and working through policy action and actions to address. So organizationally, how do we achieve this? First of all, our organizational structure, and Rosalind also mentioned that we have 12 established national affiliates around the country, primarily in the southern region and the Northeast. Corporate agreements with pharmaceutical companies and others, and partnerships with over 125 organizations, including Black Health Matters. And that gives us an opportunity to make sure that our message gets out there, as well as an opportunity to work in partnership with these organizations on common issues that we share. And certainly Black Health is a major partner because of the work that they continue to do. We work with a broad spectrum of local, state, and national leaders in government, the public sector, the private sector, and various other stakeholders, including, of course, faith-based organizations, media, social justice, and community-based organizations. So that is extremely important in terms of how we're able to get our messages across. So through our advocacy efforts, what we typically do is that we train leaders to be community advocates through our leadership mobilization and advocacy boot camp training program. Because what we recognize, so many of our community workers are working really hard, and at the end of the day, they may have helped one group or one block, but we want to be able to train them to be advocates in order to have more impact overall. And through our policy work, we certainly do advocate for legislative changes around testing, around insurance, and other key policy issues. And I can't wait for us to be able to walk through the halls of Congress again, as well as our state capitol and our city halls, because it is important that we engage those who are elected to represent us and those who establish policy in order to ensure that we are making a difference. Through our action umbrella, we promote community leadership and engagement to ensure that the process, or rather that the people, are informed about prevention and treatment efforts. So this is very much a part of our advocacy, our policy, and our action in order to achieve our mission and our vision. Overall, our programs again include advocacy and policy, community mobilization and engagement, health and wellness education, leadership training and development, organizational capacity building, and technical assistance. Racial health inequities persist. Although African Americans and Blacks only make up about 13.4% of the population, African Americans, as you see, just between the ages of 18 to 64, have a greater risk of early death than whites. Black Americans, ages 35 to 64, double the risk for high blood pressure compared to whites. Black Americans, 18 to 49, twice as likely as whites to die from heart disease. And so with COVID, we recognized that we had to make a shift, and we were able to pivot based on the work that we do, community-based organization, mobilization rather, working with leaders in the community, because the essential workers, many of them from our communities, who did not have the option of working at home and at the same time wanting to provide for their family. So with COVID-19, we also know that pre-existing conditions were extremely, as we just showed in previous slides, are extremely high in the Black community. So we had to go to work. And the good news is we were able to move forward based on the strengths and the nature of our work throughout. And what I'm sharing with you now is related specifically to New York City, but many of these activities are still taking place throughout upstate New York in our affiliates, as well as in Long Island. By partnering with New York City, we have been since August of 2020 doing outreach in the boroughs, each of the boroughs throughout New York City, the Bronx, Queens, Brooklyn, Staten Island, and of course, Manhattan. And we're working with various partners, including Harlem Black Pride, various churches, Holcomb Rucker Foundation, and different groups in order to make sure that we are working with people locally to do the work. Some of the events that we have been involved with since August, again, of last year, includes street outreach. Our staff and our partners have been in the street, wearing protected gear, of course, practicing social distance, doing outreach in the streets, in the parks, grocery stores, New York City housing authorities, day of actions. And they were identified because so many of the numbers based on the zip codes were within those areas. They worked at food pantries as well as the post office. And that just a highlight of some of the events that they were involved with. So since August of 2020 through April of this year just simply gives you a snapshot of some of the impact of the people we've reached through over 1,300 events. Some 277,000 people have been reached. We have distributed over 1,500,000 masks and COVID literature, over 271,000 pieces of COVID literature. We've also referred people, over 8,000 people, for testing in terms of COVID. And some of this includes the pop-ups that we see around the city of New York, as well as in other cities and areas. Pop-ups using the mobile van and the Quickie Lab. Black Health, National Black Leadership Commission on Health, actually referred to now for a shorter name, Black Health. We've conducted over 57 webinars, town halls, and online events, reaching over 6,000 people. And through texting, sent, and emails, some 23,000 and almost 10,000 there. And through our efforts, we have been able to recommend and have vaccinated. I'm so sorry, I dropped my mouse, and that happens sometimes in all of this that we do, right? Okay, where am I? Where am I? Where am I? Here I am. Okay, so we've been able to make appointments to get people vaccinated, over 600 and some appointments, but we have also been able to get over 2,000 people actually vaccinated. So that's the impact, and what are some of the lessons learned? And again, I'm sharing with you specifically our work here in New York City, upstate New York, and Long Island, but we are in contact with groups around the country like the National Association of Black Mayors and the Public Policy Agenda Group, in order to share with them what our work has been and the challenges that we have faced, so that as many other cities move into doing what we have been doing since August of last year, perhaps our experiences can help. So again, some of the highlights that we have found during this period is by having day of actions at specific locations with tabling and working with the leaders in these communities. That has helped us tremendously in terms of being able to make sure that we get through, that we're engaging them. But some of the challenges we see: lack of information about vaccines, misinformation about testing, and whether or not they have to pay or not. So we've recommended to the city, and we are seeing difference there. That's part of that advocacy moving forward. More people need to be hired, and there needs to be more data collection for the for the vaccines. Other highlights is that we have it's important to partner with your local city and H&H's Health and Hospital here in New York City. And we partnered with them because we started the mobile van crawl, identifying locations and areas with high foot traffic. And we were able to say, no matter what we hear about hesitancy, and clearly there is a lot, people do want to get tested, but they need information. They need information They don't have access to technology. Many people still do not have emails or phones, and the staff in these vans must be bilingual or community friendly in order to engage the community. So through our advocacy efforts, we've been able to expand outreach using grassroots organizations and census, using the information that we have in order to move forward. And we've been able to train others groups in order to make sure that they are on board with what it is that we have to do. So I recognize that my time has ended, but I will end by saying that through the vaccine appointments, again, we have been able to get over 2,000 people vaccinated simply because of our outreach and engagement with the community. Yes, that's me there in the coat, in the hat on a Sunday morning at one of the labs. But our recommendations for vaccine outreach, again, is that we need to register people on the street or go door to door. We need to expand the locations. We need to maintain locations in long term, not just pop-ups. We need to be there with tabling over a period of time. Community-based organizations are important. We need to partner with others, including continuing with faith-based organizations. And we need to hire bilingual staff because that's needed throughout the country. And there must be better communication with community-based organizations because of what it is that they do and the information that they have. So with that in mind, I know that my time is up, but I wanted to share that information about our work with you. And I do invite you to go on our video as part of the exhibitions, because at least there you can get more information about our work, about what it is we have done and what it is that we continue to do. But it's because of partnerships like with Black Health Matters and so many of you who are probably on participating in the conference today. That's just an overview of the National Black Leadership Commission on Health, our mission, our vision, our work, our impact and results. And I thank you so much.